everyone, this is kRystinne Espinosa, and today we are doing the thorax and lung assessment. Patient, please come in. So as always, you're going to introduce yourself to the patient, and you're going to check their name band. Is this your correct information?
Yeah.
Okay, perfect. So then you wash your hands, and you come back and explain to the patient that you're going to be doing the assessment of the thorax and the lung. First, we're going to inspect the supraclavicular areas. We see there's no swelling, no tenderness upon palpation. Then we're going to check the axillary lymph nodes. We're going to check along the chest wall and the anterior border of the axilla, then the posterior border and under the arm. There's no swelling of the lymph nodes noticed and no tenderness upon palpation. So next, we're going to just briefly talk about the breast exam. Even though my patient is a male, it's still important for males to do self-breast exam. So, just feel around for any lumps or tenderness occasionally, and it's very important to look at that. Next, we're going to do the thorax and lungs. First, we see that the patient's facial expression is relaxed, the skin color is even, the lips and the nail beds are free of cyanosis and they're pink and normal. Respirations are regular and even, and the rate is within normal rate. The patient is awake and alert, and the patient has a relaxed posture with the arms to the side, and there's clearly no respiratory distress. So I'm going to ask the patient to turn around so we can start with the posterior thorax. So first we're going to check for chest expansion. We're going to put our hands right in the center of the thorax and ask the patient to take a deep breath. And there's even expansion with a deep breath. We see that the spinous process is in a straight line, the thorax is symmetric, and the ribs are downward sloping. The neck and the trapezius muscles are even and normally developed. Then we're going to palpate. We see that there's no pain upon breathing. We're going to check the fremitus, so I'm going to ask the patient to say 99 every time I touch.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so normal fremitus is noted. And now we're going to percuss. Oh, also upon palpation there was no lumps or masses or lesions noted. We're going to percuss. First along the top of the shoulders. All along the percussion that we've been doing, there is normal resonance noted, signifying healthy lung tissue. Okay, now we are going to percuss for the diaphragmatic excursion. We're going to start up here, and we're going to ask the patient to take in a deep breath, exhale, and hold it there. Okay, so we're going to mark with our pens. Now, take a deep breath and hold it. Okay. And here we measure this area to be about 5 centimeters, which is within normal limits for the healthy adult. Now we're going to auscultate the breath sounds. Okay, so I'm going to ask you to take a deep breath every time you feel my stethoscope, okay? sides. Perfect. Okay, so no abnormal breath sounds were noticed and no adventition breath sounds. So now we're going to turn the patient and we're going to do a similar assessment in the front. Okay. So again, we're going to inspect the thoracic cage. We notice that the neck and shoulder muscles are normally developed. There's no lesions or masses noted. Do you have any tenderness when I'm palpating anything? No? Okay, perfect. So we're going to do the fremitus again. You can also use the phrase blue moon for this. So we're going to start here. You can say 99.
99. 99. 99. 99. 99. 99.
Okay, perfect. So normal fremitus is noted again. We're going to percuss. Okay, perfect. And now we're going to auscultate in the front. Okay, so just take a deep breath again when you feel my stethoscope. Good. We're just going to keep going side to side. Okay, perfect. No abnormal breath sounds were noted in the anterior thorax as well. And that is the end of the assessment. Thank you so much.
You're welcome. And now we have determined